Haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Luftsichel sign and the flat waist sign. So Luftsichel sign is seen in the left upper lobe collapse, The wheel opacity. The wheel opacity is anterior to the oblique. It is anterior to the oblique fissure. Seen in case of the lateral chest X-ray. It is seen in case of lateral chest X-ray. There is also the sickle-shaped air. It's surrounding the arch of the aorta. So it is seen in the left upper lobe collapse. The wheel opacity anterior to the oblique fissure. Seen in the lateral chest X-ray. The sickle-shaped or the surrounding of the arch of the aorta. Then we move on to the flat waist sign. The flat waist sign is it refers to the flattening of the left heart border. So flat left heart border is what is seen, and specifically the contours of the aortic arch. And adjacent pulmonary trunk as well. And it is seen in case of the severe left lower lobe collapse. So severe left lower lobe collapse and is caused by the leftward displacement and rotation of the heart. Leftward displacement and the rotation. So rotation of the heart. To learn and grow daily like this, please do subscribe.